is 1208. Prostate cancer is one of the most common types of cancer. And Dr. Timothy Quinn joins us for today's Focused on Health to talk about just how important it is to be diagnosed early from personal experience. Dr. Quinn, as always, thank you so much for joining us. Tell us, what are some of the more common early warning signs of prostate cancer?
Well, prostate cancer is one of those cancers that's very prevalent for men. Of course, men are the only people that have prostates, but some men have increased urination, problems with their relations with their wife, intimacy, or they might have fatigue or blood in the urine. But I want to just give this scenario I gave to a patient, why it's so important to diagnose cancer early. It's the same thing as if you were cooking in your kitchen and your dish towel caught fire on the stove. You caught it early. You dash water on it, you put it out, it's over. You don't catch it. Let's say you don't catch it and you're in the bedroom and the fire just burns, the whole kitchen burns up, the living room burns up, the whole house burns down. That's the way cancer is in most medical conditions. If you catch it early, you can do something very effectively, including prostate cancer.
All right, thank you so much for that. Catching it early, but also what are the lifestyle changes that people can do at home right now watching this here on 12 News to reduce the risk of prostate cancer?
Talk to your medical provider. Make sure you're getting your physical exam every year. This is the beginning of the year, and if you have not already done so, schedule your physical, and then your healthcare provider will talk about your risk factors, and then they'll do screenings based on your history. What's very relieving to a lot of my men is they learned we don't have to do the rectal exam anymore. That's what kept a lot of us men away from the doctor. We can now do it in the blood as the PSA, prostate specific antigen lab test. And if it's a little bit elevated, then we have reason for suspicion. But a lot of our men are so relieved that they don't have to do that man test. Talk to your doctor and find out when it's time for you to screen based on your age and your history.
Okay, Dr. Quinn, tell me about your family history with prostate cancer.
Well, my grandfather died from prostate cancer. He did not go get screened. He believed that you just trust in God and it'll be okay. But on his deathbed, he encouraged me to tell his story so his death would not be in vain. He encouraged me to let people know that God works through people and technology, and that's how we are so able to help people catching it early, like catching that dish towel when it's burning on the stove, knocking it out, saving the whole house, saving the body, saving the temple. So go talk to your medical provider and get that screening, and it can save your life.
Thank you so much, Dr. Quinn. Really quickly, is there anything else that you'd like to add that I haven't asked you?
Just so thankful for this opportunity to share my grandfather's advice.
All right. Appreciate you, Dr. Quinn.